How many of you know what compartment syndrome is? I chose this topic because when I was a sophomore, I was diagnosed with exercise-induced exertional compartment syndrome. This means that every time that I would exercise, the compartments in my legs would swell and build up pressure. When this would happen, my legs would start to feel numb, heavy, and achy. Today, I am going to inform you about the different types, signs and symptoms, causes, and how to treat compartment syndrome. There are two different types of compartment syndrome, acute and chronic. Acute compartment syndrome develops after an injury such as a broken leg. Chronic compartment syndrome is caused by exercising too much. The signs and symptoms of compartment syndrome are numbness, tingling, and swelling. Causes of compartment syndrome are either previous injury or exercising constantly. There is really only one way that you can diagnose compartment syndrome. Unfortunately, compartment syndrome is diagnosed by a very painful test. The test consists of a medical doctor putting a catheter in each of your 4 muscle compartments. Once the catheters are in, the doctor will then get a pressure reading while your legs are at rest. Next, the doctor will wrap your legs up with an ACE wrap. After your legs are wrapped up, the doctor will have you run on a treadmill for approximately 20 minutes. Some people will not make it the full 20 minutes. After the run, the doctor will then take another pressure reading. This pressure reading is what determines your diagnosis. There are a few different treatment options for compartment syndrome. Your treatment plan will be based on the type of compartment syndrome that you have been diagnosed with. Most likely, someone who has been diagnosed with compartment syndrome will need to have a fasciotomy. This is a surgery where the surgeon will cut the fascia in the affected area to release the pressure. The recovery time is around 6 weeks for this surgery. Another type of treatment that one might consider is physical therapy. Your physical therapy will consist of dry needling and e-stim. Today I have informed you about the different types, signs and symptoms, causes, and how to treat compartment syndrome. At the beginning of this video, I asked the question, how many of you know what compartment syndrome is? So now consider, what can you go and tell your friends about compartment syndrome?